giving the ultrasound of upper abdomen images of an asymptomatic middle-aged man who has come for health checkup. The images are focusing the epigastric region in the mid-sagittal section on B mode and with color Doppler. What's the diagnosis? There's a very short common trunk which is then bifurcating as celiac axis and superior mesenteric artery on B mode and on Doppler. They are widely patent and show normal angle with no stenosis or occlusion or aneurysmal dilatation. The Doppler image might be misleading due to lot of color aliasing. The visualized aorta appears normal on B mode and on color Doppler. The diagnosis is probable type 1C of short type celiomesenteric trunk. The confirmation needs MDCT angio or MRI or DSA. That case was incidentally detected in the ultrasound abdomen screening during the health checkup, so nothing else needs to be done. Embryologically, 4 separate arterial branches arise from the primitive dorsal abdominal aorta. The 4 branches are left gastric artery marked as LGA, hepatic artery marked as HA, splenic artery marked as SA, and superior mesenteric artery marked as SMA. They are all linked by ventral longitudinal anastomosis marked as VLA in the given image. Normally, the ventral anastomosis between the 3rd and 4th roots disappears to form the celiac artery and SMA in the given image. If this anastomosis fails to disappear, then the celiomesenteric trunk develops. Please go through the given images again and mentally print them in your deep brain. Before the detection of multi-slice CT, some variations have been documented in the hepatic artery or in the celiac axis or in the celiomesenteric trunk. But after the advent of multi-slice CT with angiogram, many more variants are being detected in this decade. So the protocols have been changing in the gastroenterology and in the vascular specialties. This information on imaging may be crucial to the surgeon preoperatively in major upper abdominal surgery such as Whipple's procedure. It might also be important information about the hepatic artery variants that could be very useful preoperatively, the more common surgery being cholecystectomy. It is very easy to diagnose the celiomesenteric trunk on any imaging, but not easy to diagnose the variants in the smaller hepatic artery and its branches. To be a good radiologist, it is important to memorize the branches of the celiac axis and of the common hepatic artery and of the proper hepatic artery. See the normal anatomy of the celiac trunk and of its branches and of the anastomosis. Please go through it in your leisure time and you can become confident and can impress the surgeon by your theoretical knowledge. All the best. That's end of the session. Thank you very much for your patient hearing. Dear doctors and radiologists, please share this with your groups and with your residents. Give your valuable comments and suggestions. Thank you again.